Good morning everyone. I am Tania Sharma, lecturer, Faculty of Nursing, Rama University. So today I will discuss about the introduction to community health nursing. So before going to start the actual topic, exact topic at community health nursing, firstly we will discuss about the meaning of community. Community means to group of people who are living in a same geographical area and follows the same culture, traditions and their beliefs and their values. So basically community means to the group of peoples who are living in the same areas and share their common interest, values, traditions, religion and beliefs of their particular custom or any religion. Next is the community health. So as we all know, health is the complete state of physical, mental, social and well-being and not merely the absence of disease or illness. So in the community health means to the total health status of the community people, in which we include all the totality of the health aspects like physical, psychological, social, cultural, economical and the occasional or vocational dimensions of the health. So in the community health we provide all the health services. We improve the main focus on the health status of the individual, and we try to find out how we improve the health of the particular family, particular individual or the particular community or society members. Next is the community health nursing. So as we all know, there are various type of branches in the nursing profession. So one of the branch is the community health nursing. So community health nursing is the basically main branch of the health nursing system and nursing care profession. In this we provide all the preventive, promotive, curative and rehabilitative services to the particular individual as well as their family member and in the particular community region. Next is the aims of community health nursing. Basically the community health nursing, we provide the community health nursing and we provide the healthcare services to the community people, all without any kind of discrimination. So main aim of the community health nursing and the main goal of the community health is to provide the promotive, preventive and curative services to the community peoples as well as in individual sector or in family or in community regions. And the second main aim of the to reduce the morbidity and mortality rate of the community people. So as we all know, morbidity and mortality rate. Morbidity is the disease rate of the particular area, how many diseases are affecting the individual as well as the family members as well as in the community sectors. And in the mortality rate means to the death rate, how the individual will be died due to any kind of disease or any kind of illnesses, and we have to reduce the risk of morbidity and mortality rate, and we strengthen out the health services in the community region to provide the promotive, preventive and curative services to the community peoples. Next main content is the principles. So basically principles of community health nursing. If we talk about the community health nursing, we have many principles. We have to memorize in our brain many points which we have already followed by providing the community health nursing services. So basically the first principle of community health nursing is it should be planned always. Any kind of services, any kind of nursing care facilities, if we provide it as a healthcare professional, it should be pre-planned. It should be already decided what we have done in the community region and what we have to provide in the community peoples, and to have how we improve how we prevent the particular person regarding any disease. Next, it should follow ethical rules. So as we all know, in the nursing profession there are various legal or ethical issues, and we have to follow all the guidelines, all the laws and legal issues of while providing the care to the any individual or any community sector. So in the community health nursing services, we have always follow the ethical rules. We do not touch the patient without their permission. We always maintain the IPR, we always maintain the gap between the nursing care professional and the family members. We have to follow the standards of our profession. We have to maintain the dignity of the particular profession. Next is the without discrimination. So always what we have to provide the services like community health nursing services, always we have to provide all the individual without any kind of discrimination. Discrimination like on the basis of their age, gender, religion, caste or any kind of another factor. We do not have to discriminate the community people. We have provide all equitable distribution to all services to all the community people. Next is that it provide the comprehensive care. We have to follow all the concepts of the health like physical concept, ecological concept, psychosocial concept, spiritual concept, vocational concept and the other concepts of the health. We have to provide all complete services to the particular family, community, and we have to maintain the dignity, and we have to always improve the standards of the nursing care profession. And next is the provide of knowledge. We can say that the provide of knowledge or the provision of knowledge. So always in the community health nursing, we always improve our communication skills. We always improve the health education and IPR, health education sector, or we have to improve the IPR, interpersonal relationship with the community or the family members or the particular individual. So in this community health nursing, we always try to improve the knowledge level of the particular community peoples and particular individual. We try to explain all the causative factors, sign and symptom and of the diseases, and we have to try to focus on the particular diseases which are epidemic or endemic. So I hope this is clear principles of community health nursing. Now next is the community health nursing process. So basically in the process, community health nursing process, basically the series of steps which we have followed while providing the community health nursing services. In this we have to follow a systematic steps in which we improve the health status of the community peoples. So in this first process is there are many strategies or there are many components. So first one component is the maintain the IPR. So maintain the IPR. IPR means to interpersonal relationship. Always, as we already studied in our lower classes in our starting of the nursing profession, IPR, interpersonal relationship. Always nurse has the main responsibilities of the communication skills. She should have a maintain or improve their communication skills with the patient as well as their family members and the other sectors of the particular profession. So we have to always first maintain the IPR with the community peoples. We should always follow the rules, always assess the situations of the particular community area. In this we always greet the peoples, we always greet the family members, we always know about the reasons, and we should always tell the reasons of our visiting. Next is the assess the or gather the data. So in this assess or gather the data, we have to we have to follow the IPR, we have to maintain the IPR with the patient and as well as their community peoples or the family members. So in this we always provide, firstly we will always ask about the history. As we are working in the hospitals, firstly we have to identify the biographical information of the particular patient. In this, in the community health nursing, we always assess or gather the data of a particular family. In this, firstly we have to assess the geographical data. Geographical data. So geographical data regarding the buildings, regarding the streets, regarding the landmarks, regarding the institutions in which the community belong. In this we have to assess, we have to gather the information regarding the streets, regarding the buildings, regarding the infrastructure. So main focus in this data, we always focused on the institution, buildings or infrastructure. Then next is the demographic. So demographic data is the mainly we have to focus on the age, gender, we have to collect the information regarding the age, gender, caste, religion in which they belong, particular region in which with caste, and their racial and the other factors which are included in the demographic data, like number of family, family status, family income, and the occupation of the particular person. Next is the health assessment. So in the health assessment, we always gather the information regarding the health assessment. Health assessment means to the history, previous history or past history, past medical history or past surgical history, if any surgery or any kind of medicines patient have or the individual have or the family have, or any kind of metabolic disorders or any kind of other illnesses or disease in the family members. So we have to collect all the information in the second component, which is health assess or gather the data of a particular community, people or particular family. So in the third point, in the third component, make a plan. Before we maintain the IPR, assess or gather the information or data, after that we have to make a plan. How we plan, how we provide the care, curative services to the particular family members, how we provide the particular preventive services to the family member, and we have to make a plan. We have to set up components and we have to maintain the, make a strategies of a particular treatment of particular illness, how we provide the services to particular person or particular family members. Then next is the implementation. So in the implementation, in which previously we have to make the plan, after that planning, after planning we have to implement those services in which we have to already planned. We have already focused on that particular plan and we have to provide the services accordingly. After that, evaluation. Evaluation, we have to evaluate how we have to make the plan and how we implement the services and how we improve the particular condition of a particular patient or family members or the community, how we maintain the good health condition of the health status of the individual as well as their family members, how we promote the health services, how we reduce the morbidity and mortality rate of a particular geographic, particular community area. So these are the components of the community health nursing process. I hope this is clear. So next is the role of community health nurse. Roles. So in the community health nursing, we already discussed about the definition of community health and community health nursing. What is the meaning of community health nursing? We already discussed about the aims of community health nursing and what are the principles and the process of the community health nursing. After that, we have discussed about the roles of community health nurse. As we already studied in the lower starting of the nursing profession, roles of the nurses, roles and responsibilities of the nurses. So being a community health nurse, what should be your roles and responsibilities to a particular community area? First is the health promotion, health promoter or health promotion. Health promotion, how we improve, how we promote the health of the particular area, particular peoples and particular community and particular families. So how we promote, maintain the IPR and improve the lifestyle and reduces the risk of the lifestyle factors. We have to always encourage the family members to do exercises to maintain their nutritional pattern, to vaccination their children and to improve the health status, and always do exercises to reduce the any kind of medical diseases. Follow up. As a community health nurse, always as a any kind of any you have to belong any stream of the nursing profession, we always follow up the patient, follow up our patient or their family members. So in the community health nursing, as a community health, you are the main responsible for the follow up. Okay, so as we already provide the services, how we assess the condition of the patient after providing or after implementing our services. So we always do the follow up services, follow up in the after a one visit, after a 1 week or 2 weeks, we have to always visit the same particular family, same community, and we have to assess the condition, how they improve their health and how they reduce their risk factors. Counselor. So as a community health nurse, you should be counsel the patient or their family members, because there are some diseases who are in high risk status and vulnerable groups, and they thought, the people of the community areas, they thought that this disease is not good, this is the myth, and there are misconceptions about the particular diseases. So we always present there to avoid that myths and misconceptions and to reduce that myths and misconception. So we have to follow, we have to always counsel the particular family members, and we have to encourage to do the same services which we have to given that particular family, and we always assist the patient family to provide that particular services. Strengthen the services. So next is the strengthening the services. Already our government of India provide all kind of programs and provide various types of services in the community region. So as we all know, we as a community health nurse, we always maintain and we always improve the services to a community region. We have to encourage the families, encourage the particular individual, and encourage the leaders of particular area to how they strengthen their services in the particular in their own region, and how they improve the health status of a particular villages. So these are the roles in community health nursing. So next is the, as we already discussed about the health, we have always main priorities are health and the community people's health. So health, meaning of health. So as we all know, health is a multi-dimensional. Health according to the World Health Organization, health is a state of complete physical, mental, social well-being, and not merely the absence of disease or illness. If we thought the person is not in the disease or any kind of illness, the person is, we have to check the person and we have to assess the person, and we have to maintain the person's living standards, and we always try to find out how the health of the particular person is improved and how they can be a healthy person. So health is a kind of absence of, if the person in any kind of absence of any kind of any illness or any kind of disorder, the person is known as a healthy person. So in this various concepts of the health, so there are various theorists or there are various scientists who provide the concepts of a particular health. Concept of health, there are mainly 4 types of which we have focused on the concepts of health. So first is the biological concept or biomedical concept. Biological or biomedical. Next is the ecological concept. Next is the psychosocial concept. And last is the holistic concept. So in the biomedical concept, according to the biomedical concept, if the person's body, any kind of microorganism, pathogenic microorganism enters in the human body, if any kind of pathogenic microorganism enters in the human body, it will causes illness or any kind of disorder. So according to this concept, they only thought that if the pathogenic microorganism enter into the human body, it will cause the illness or any kind of disorder, and it will be the only factor which influence the health status of the particular individual. So after that, second concept is the ecological concept. Ecological concept means to the environment. Ecology means study of the environment. So ecology of the particular person, like the surroundings, like the air, water, supply, sanitation, ventilation, all are in this the psychological component concept. So in this we always focus on the environment or surroundings of the human beings of a particular person. So in this we always try to improve the health condition by modifying their environment standards, by modifying their water supplies. If, as we all know, if the water is not pure, if the water is not clean, able to drink, is not able to drink, it will cause the diarrheal disease or any kind of other infectious disorders. And if the air is not pure, and if air is not clean, and if ventilation is not properly maintained, then the person will suffer from a respiratory problem. So in the ecology concept, they only thought that the environment factor is always influence the person's health. So I hope these two concepts are clear. Next is the psychosocial concept. Psychosocial. So in this concept, two factors, psychology and sociology. Psycho and social. Psychology means our mind, mental healthy. Okay? If the person is mentally healthy, if the person is psychologically healthy or well-being, then we have to say that the person is healthy. According to this concept, if the psychological as well as sociological concept of the particular person is correct or is functioning properly, then we say that the person is healthy. So in the psychology, we have to check their emotional status, their mental status, their drive, maintaining the communication skills with their colleagues, with their members, with their society, social groups, how the person improve their social groups, how they maintain their friends, how to improve the gatherings of the particular society, and in the socially, how they maintain the harmony of the social groups. If the person is not maintaining that particular patterns, and then if the person is not able to try the maintain or IPR or any kind of social groups, then the person may be any kind of problem in the psychology as well as their social health. Next is the holistic concept. So in the holistic concept, holistic matlab complete all the concepts, like in biomedical concepts, ecological concept, psychosocial concept, all the concept are come under the holistic concept. So in this we have to always focus on the physical as well as biological health of the person, psychological health of the person, social health of the person, and as well as the environment of the particular region or particular person or any kind of family environment. So in this holistic concept, we try to find the particular factor which influence the health status of the particular person, and we always focus how we improve the physical as well as their psychological and social health of the particular person. So these are the concepts of health. Next is the dimensions of health. As we already discussed about the dimensions, like in which the health is already included in the dimension, there are various kinds of dimension. As we all know, health is a multi-dimensional. So dimensions like physical dimension, social dimension, vocational dimension, mental dimensions, spiritual dimensions, and the occupational dimension. So first is the physical dimension. Physical dimension means to if the person's physique is properly maintained, or person is not influenced any kind of disorder or any kind of illness, if the person is maintaining their physiological functions of their body, particular organ and particular body of the person, then the person is the physically fit and fine. And if the person is not try to avoid any kind of illnesses factors or any kind of risk factor, the person is physically fine. Then second is the mental dimension, mental, or you can say that the emotional dimensions. If the person is maintaining the proper communication skills, if the maintaining the proper communication with their colleagues, with their social groups, and improve their love and belongings to their particular family member, if the person is able to communicate effectively, is able to communicate properly, and if the person is not isolated, if the person is improving their standards, and if the person is know their self consciousness, if the person is conscious about self and the other persons, then the person is the mentally healthy person. Next is the spiritual dimension. So spiritual health kind of their deepness of the self. If we identify the ourself, how we are here, how we can do this thing, and what are our self dignitaries, and what we have to do in a particular stream or particular thing, how we are already assess our risk factors, and we already assess our limitations, and we already know about the particular person, and we already know about ourselves firstly, then the person is the spiritual healthy person. Next is the vocational dimension. So in this vocational dimension related to their occupation, related to their working areas, related to their living skills, how they show interest to the particular occupation, how they show their particular integration with their colleagues and with their opponents and with their particular head leaders of the particular group. And we have in this the vocational dimension, how they earn their money or how they improve their standards with the living skills, then the person is the vocationally healthy person. So these are the dimensions of the health. After that, last topic is the health promotion and maintenance of health. How we improve, how we promote the health and maintain our health. Health promotion and maintenance of health. So health promotion is a kind of how we promote our health as well as the community people's health, and how we prevent the health of the particular kind of diseases and particular illnesses, and how we cure the particular kind of illnesses or diseases to a particular family members or individual as well as their community. So in the health promotion, we always focus on the all aspects of the health, like in a promotive way, preventive ways, curative way and rehabilitative way. We have to provide all the services regarding the promotion of the health. So in this, we always focus on the how we can reduce the risk factors, and how we improve the lifestyle skills, and how we strengthen out the services of the particular community health services, nursing services, and how we increase the awareness, self-awareness as well as the awareness of a particular diseases. Now, next is the health promotion strategies. So in this health promotion and maintenance of the health, so firstly we have to maintain the promote the health of the particular individual as well as the family members, and there are various kind of strategies. First is the nutrition, how we improve the nutritional status of the particular person's family members, and according to the age, there are different kind of diets which we have to provide to the particular family members. Next is the lifestyle factors. So we always improve the lifestyle factors, we always strengthen we should always educate about the exercises, avoid the junk foods, and avoid those foods which always irritate and which always causes the illnesses, and we have to always focus on the lifestyle patterns, like avoid the smoking or drinking, and we have to always improve the health status of the particular family members. The next is the meditation. So as we all know, we have to improve our mental health, so accordingly we have to meditate or do some relaxation therapies in our house. So we have to promote the health as well as the maintenance of the health. So this is all about my topic. If you have any query, then you will ask in the comment box. Thank you.